And welcome to Sugar Talk with Dr. KG and Lucas. Doctor's in the house. Hi, Doctor. How are you?
I'm good.
All right. What are we talking about today?
Fatty liver.
That sounds like a fat shaming term. Is that? But it's not, huh? It's politically
It's
correct.
probably not politically correct.
All right.
It's
But
a
it is
medical term.
But it actually is a medical term, right?
Yeah, so it's not fun. It's not supposed to be funny.
Yeah. Okay.
You know, fatty liver. You're not like insulting people, or you're not, accusing them of being fat. That's not what it is. It's that the liver has fat in it, and too much fat.
Right.
So when you accumulate fat in your abdomen, not only do you get it under your skin or in your abdomen floating around, but you also get it in the organs. And I think that's what a lot of people don't think about, that if they're overweight, especially abdominal fat, it's not just on the outside, it's on the inside. So it may infiltrate organs, not only just the liver, but the pancreas and other organs too. It gets in there, and the liver can handle some fats, but not a huge amount of fat. So if you've got a huge amount of fat deposited in your liver, it affects the liver cells.
Now, when we think about a problem with the liver, I think most people probably think about drinking. That somebody's had too much alcohol.
Yeah, and of course, alcohol is the most common reason for fatty liver. So there's this thing called NASH, NASH, which is non-alcoholic steatohepatitis or hepatosis, depending on what the inflammation level is. And that means that wasn't caused by alcohol. So even if you don't drink and you have fatty liver, there's other reasons. And actually, this other reason is probably the most common. Alcohol is probably not the most common cause of fatty liver anymore because of the obesity epidemic. So people getting fatter tends to make the liver accumulate more fat, which damages the liver cells. And when you damage the liver cells, it's not good. The liver is very important. The liver makes a lot of proteins for the body, clotting factors and albumin. And it also detoxifies you or gets rid of toxins in the blood, especially ammonia, and it metabolizes medications. So the liver is very important for to filter out everything in the body and get rid of all the bad stuff. And if you don't have the liver working properly, you don't get rid of these things. And one problem is that you start having problems with clotting your blood because the clotting factors aren't made. You start having problems with swelling because proteins are not made that cause you not to swell. You get scar tissue in the liver, which backs up the blood flow to wherever it can back up to. So a lot of times people get dilated blood vessels in their esophagus, and they have bleeding. It's called bleeding varices, but they're varicose veins in the esophagus from the backup of blood from a scarred up liver.
Can you have platelet issues that are related to that?
Yeah, platelets are sucked into the spleen. The spleen is another problem because the backup of the blood enlarges the spleen, and when the spleen's large, it just sucks up whatever it wants to. So usually platelets and blood cells, and just stores them in there. It doesn't let them out. So you get low platelets, and you'd have to sometimes get a liver transplant if your liver was that damaged. So it's a serious thing. Fatty liver, everybody goes, oh, I got fatty liver, I got fatty liver. But it can be a serious thing. It can lead to cirrhosis. So that's what you don't want it to happen.
Well, before we get to that part, I just said, is it genetic as well?
Yeah, everything is,
Yeah.
pretty much.
So the tendency to obesity may be genetic, right?
It is.
So that may then lead to all these.
Yeah, and some families have a history of people having liver disease, and they weren't drinkers. They didn't drink alcohol. And so people think, well, maybe you did drink alcohol, but they really didn't drink alcohol. They had fatty liver from this genetic tendency to store fat in the liver if you're overweight. So it is caused by obesity. That's the major cause. And of course, obesity leads to other things like diabetes and heart disease and high blood pressure. So anytime you can lose weight in your abdomen, and we talked about the waist measurement, which is really not waist, but belly, belly measurement, really talked about that. So that's important because not only does it measure, how good your clothes are going to fit, but it also measures what's inside. So the bigger your abdominal circumference, the more risk you have of all these things, of diabetes and fatty liver, high blood pressure, high cholesterol, all that.
Now, cirrhosis comes in stages, doesn't it?
Right, and the fatty liver, the way you would tell if you were getting any problems with it, you would biopsy it. And you have some fibrosis at first, and fibrosis may be spotty, and then it gets worse. So the fibrous tissue takes over the liver, basically. The liver cells are being destroyed, and just scar tissue is replacing it.
So, and you say cirrhosis can be a result of that. Is that treatable, or is it reversible?
No, cirrhosis is not reversible once it's totally scarred up. Once your liver is totally scarred up, you'd have to replace it. And you'd have to replace it before all these things happen with the backup of the blood flow, the enlarged spleen. You'd want to replace it before then.
Right.
But most people, luckily, don't have to do that. That's like way down the road, and you'd have to be pretty severe. It's probably genetic whether you're going to be severe or not. But fat accumulation in the liver does raise your liver test on your blood test. So the routine blood chemistries that your physician does a lot will have the ALT and the AST, and those are liver enzymes. So they're in the liver cells, and when the liver cells are damaged, those enzymes are released into the blood, and you actually pick this up really early. So a lot of times you'll pick up these mildly elevated liver tests, and you'll make sure that they don't have hepatitis B or C or something like that, or they don't have any liver tumors or anything else causing the liver disease, and then the fatty liver looks different on the ultrasound than a regular liver.
So, and treatments then? Where do we go?
Treatments would be losing weight.
Is that,
That's so easy.
Yeah, that's the primary one.
But actually you want to lose abdominal fat. If you have diabetes, you want to get your diabetes controlled. Some people with this problem also have high triglycerides, and the triglycerides tend to accumulate in the liver as well, so that's another fat that accumulates in the liver. So you want to correct everything that's causing either the blood sugar to be high, the triglycerides to be high, or the weight to be high. So the other thing, the interesting thing is there's a diabetes drug called Actose or pioglitazone that's been used for fatty liver, and it actually helps it. And they don't know why, but it does work in the liver to help the diabetes also. So it's sort of an interesting concept.
Now you're doing some studies with triglycerides.
We're doing some studies with triglycerides, and we also have a fatty liver study. So it's very interesting. There's no drugs for fatty liver that have been approved for fatty liver. So this one, they want people that have a diagnosis of fatty liver either by a biopsy or not. But if you don't have had if you haven't had a biopsy of your liver, then they want you to have had diabetes. They want you to have diabetes and be overweight. So you don't have to have a biopsy during the study. They'll do a MRI to look at your percent fat content of your liver. So that's included in the study protocol.
Okay, all right. Well, we'll talk a little bit more about that till we come back in just a moment here with Dr. K. Gene Lucas from lucasresearch.org. That's where you go to find out more about these studies and all the care that you can receive as well, too. lucasresearch.org, or call 222-5700, and we'll have more to come in just a moment on Sugar Talk with Dr. K. Gene Lucas.